Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Effect on of estrogen and progesterone. First, effect of estrogen and progesterone on uterus. Estrogen proliferates the endometrium and upregulates the progesterone receptors on endometrium. Because estrogen proliferates the endometrium and upregulates the progesterone receptors on endometrium, it leads to growth of non-pregnant uterus. Progesterone on uterus. Progesterone has secretory effect on endometrium. Progesterone downregulates the estrogen receptor. Progesterone can act only on estrogen primed endometrium and it leads to the growth of pregnant uterus.
Pregnant uterus growth by progesterone, whereas non-pregnant uterus growth is by estrogen.
Estrogen and progesterone effect on cervix. On the cervix, in estrogen on cervix. On the cervix, estrogen on cervical mucosa causes cervical mucus becomes thin, watery, copious, and elastic, and they can be stretched between the fingers. Cervical mucus is permeable to the sperms. They give the sperm-like appearance of cervical mucus on the microscopy. This is seen from day 8 of the cycle. Effect of cervix, effect of progesterone on cervical mucus. Progesterone on cervical mucus makes it thick, scanty, viscous, and non-elastic. Cervical mucus is impermeable to sperms. Burning appearance of cervical mucus is absent on microscopy. That is, burning disappears by day 18 of the cycle. Effect of estrogen and progesterone on vagina. First, effect of estrogen on vagina. Estrogen superficial cells predominate in the presence of estrogen. Estrogen predominates in the first half of cycle, so superficial cells are predominate in the estrogen predominance, that is in the first half of the cycle. Superficial cells are eosinophilic and they have pycnotic nucleus. Intermediate cells predominate. Then effect of progesterone on vagina. In the vagina, in the presence of progesterone predominance, intermediate cells will predominate. Progesterone is maximum in the second half of menstrual cycle. So intermediate cells are more in the second half of menstrual cycle when the progesterone levels is more. Intermediate cells are basophilic and they have small nucleus. Effect of estrogen and progesterone on breast. Estrogen on the breast leads to ductal growth, whereas progesterone on the breast leads to glandular growth. Effect of estrogen and progesterone on salt and water. Estrogen causes retention of salt and water, whereas progesterone causes excretion of salt and water. Effect of estrogen and progesterone on fallopian tube. Estrogen causes increased motility and decreased secretions, whereas progesterone leads to decreased motility and increased secretions. Effect of estrogen and progesterone on lipid profile. Estrogen increases the high density lipoproteins, decreases low density lipoproteins, and increases triglycerides. Overall, it decreases the cholesterol. Whereas progesterone decreases high density lipoprotein, increases low density lipoprotein, and decreases triglycerides. Overall, progesterone increases the cholesterol. Third and fourth generation progesterones are cardioprotective. Increase in estrogen on ultrasonography. Whenever there is increased estrogen on ultrasonography, you can see that there is thickened endometrium is seen. Increased estrogen or unopposed estrogen causes increased risk of endometrial hyperplasia and thus endometrial carcinoma. whereas decreased levels of estrogen in Turner's syndrome causes hypoplastic uterus or infantile uterus.
Thank you and thank you for watching.